Hello, everybody. We're going to give people about another minute or so to get on board, and then we'll begin. Hello, everyone. My name is Catherine Graff, and I'm the current school and child care nurse consultant with the Washington State Department of Health, and I'd like to welcome you to this webinar. Thanks for joining us for this important session. We hope you'll find this information useful and that you'll learn about the many resources available to you. Before we start the presentation, I'd like to cover a few housekeeping items. If you're having any technical difficulties, please call the number on your screen, 1-888-259-8414, and press 1. We will be keeping everyone on mute throughout the webinar to minimize distractions, so please type any questions you have in the question box found in your GoToWebinar control panel. We hope to have time to respond to a few questions at the end. This webinar will be recorded, and a link will be posted on our website. A copy of the presentation slides, which includes links to resources, is available for download in your GoToWebinar control panel. I will be talking about the school immunization requirements, and then Jeff Zahir will be sharing important information about immunization reporting. Trey Kuntz, another Department of Health nurse consultant, will be joining us when we answer questions at the end. Before I hand it over to Jeff to talk about reporting, here are the topics I will cover during this webinar. I will briefly review immunization law and then mainly focus on school immunization requirements, discussing some of the more common rules and exceptions to the rules that you may encounter. I'll review the Certificate of Immunization Status, or CIS form, and finally how the COE, or Certificate of Exemption, should be completed for medical versus personal or religious exemptions. Before we begin, I'd like to ask a poll question to all of the attendees. Please select your position. Let me open the poll, and you'll see. Is it lunch? Okay, so the poll is open. If you want to just take a few minutes, not a few minutes, a few seconds to let me know your position at the school or another position you have. And it looks like most people have reported, so I'm going to go ahead and close the poll. And let's share those results so you guys can see on the screen. Looks like we've got a pretty even mix of school nurses and school office staff with some health room assistants and other staff as well. So thank you very much for doing that and giving us that information. Okay, moving on to the law. I think I skipped one too far. So, what are the immunization laws? The purpose of the school and child care immunization laws are to protect everyone against disease outbreaks by having high rates of vaccination in our schools, preschools, and child care centers. We develop community immunity when we have high levels of vaccination coverage. This is how the school and child care immunization requirements are developed. The National Advisory Committee on Immunization Practices, or ACIP, recommends many vaccines to protect against disease. The Washington State Board of Health then determines which of the recommended vaccines to require for school and child care entry in our state. In our state, to be in compliance with immunization requirements, children must get vaccine doses at the correct ages and intervals. If any vaccine doses are invalid, the child needs to repeat those doses. If they aren't in compliance with the requirements, they need to get caught up or they may be excluded from school or child care. Parents are required to fill out the Certificate of Immunization Status form, the CIS, for each child. Unfortunately, an immunization record printed from an electronic health record is not valid. The law currently requires the official CIS to be used. It is easy to print the CIS from the Washington Immunization Information System, the IIS. The CIS printed from the IIS is pre-populated with all of the immunizations a child has in the IIS. Parents just need to sign the certificate to submit it to the school or child care center. Parents can also sign up for MyIR, which lets them see immunizations for themselves and their children and print their own CIS. If parents or guardians want to exempt or excuse their child from these requirements, they need to fill out a Certificate of Exemption, or COE form. As I mentioned previously, child care and school immunization requirements in Washington are a subset of the ACIP recommended immunizations. If providers are vaccinating children according to these recommendations, then students will be in compliance with immunization requirements. The Washington immunization requirements follow the ACIP guidelines, except some of the requirements may be applied to different grades or ages in our state. Before I talk about child care and school immunization requirements specifically, I want to draw your attention to a very useful tool. The IVERS, or Individual Vaccine Requirements Summary, can be found by clicking on the link in the slide, and it's also in the resource slide at the end. The IVERS goes through the details of each vaccine requirement for child care and school, including exemptions and catch-up rules. If you haven't already used it, I encourage you to take a look the next time you have a student in a complicated catch-up schedule. It can be helpful to send a copy of the appropriate sections with parents when they take their child to the provider. Now let's talk about the school immunization requirements, going into a bit detail, covering some of the exceptions and rules. This vaccines required chart is updated each school year. It shows all of the vaccines required for children attending school by grade with some age-specific requirements. Let's start at the top by discussing hepatitis B vaccine requirement first. All students in kindergarten through 12th grade are required to have 3 doses. Let's focus on the rules for the 3rd dose of hepatitis B, which vary dependent on the grade of the student. This school year, students in kindergarten through 10th grade are required to have hepatitis B dose number 3 at 24 weeks of age or older. If students in these grades receive 3 doses before 24 weeks of age, this dose is not valid and needs to be repeated. If you have access to the Washington State Immunization Information System, the IIS, formerly called Child Profile, the forecast will show you accurately if a student is required to repeat an invalid dose. 11th and 12th grade students are in compliance with requirements if they got dose 3 as early as 4 months of age. This is because the national recommendation in the past allowed dose 3 as early as 4 months, and we wanted to allow students who fell under these old recommendations to be in compliance rather than have to repeat the 3rd dose. The next vaccine requirement I'll discuss is the DTaP, Tdap, and TD vaccine. Students in K through 12th grade are required to have 5 doses of DTaP. Tdap vaccine is required for students in 6th to 12th grade if they are 11 years of age or older. Even though a 10-year-old student may be in 6th grade, they are not technically required to have Tdap vaccine until they turn 11. However, providers can give Tdap to a 10-year-old, and this dose would count for the 6th grade requirement. Here are a few common rules and exceptions to the rules related to DTaP vaccine. Children are recommended to get 5 doses of DTaP vaccine at ages 2, 4, 6, and 15 to 18 months, as well as a booster dose between 4 and 6 years of age. This booster dose must be given before kindergarten entry. However, a student can meet the requirements with only 4 doses. If the fourth dose was given on or after the fourth birthday, then dose 5 is not required. DTaP is recommended for all children up to age 7. The vaccine is not licensed to give to children age 7 and older. So if a student did not get a complete series of DTaP vaccine when they were less than 7, they must complete the series with a Tdap, and if needed, additional doses of TD. If a student received DTaP by accident, as a mistake after age 7, then this is considered a vaccine administration error, though this dose can be counted as valid for the age 11 Tdap requirement. No additional Tdap would be needed. Next, let's talk about some of the common rules and exceptions for Tdap vaccine. Tdap is routinely recommended for all adolescents between 11 and 12. This vaccine is also recommended for children 7 years of age and older if they're not fully immunized with DTaP. If a child is 7 years or older and did not get the full dose of DTaP, then they need to get Tdap followed by TD doses depending on their age when they got their first DTaP. The IVERS is a good reference for the complicated DTaP catch-up schedule. If a student received Tdap when they were between 7 and 10 years of age, then they meet the 6th grade requirement and do not need a Tdap when they turn 11. The next vaccine requirement on our list is IPV, or inactivated poliovirus. For students in K through 6th grades, it is important to look at the date when they received their 4th IPV dose. On August 7, 2009, the National Advisory Committee on Immunization Practices reinforced the minimum age and minimum interval recommendations for IPV. These rules were applied to kindergartners starting in the school year that began in the fall of 2011 and have been rolling up a grade each year since. So, to meet the requirement for school year starting this fall, if students in K through 6th grade received dose 4 on or after August 7, 2009, it must have been given at age 4 or older, and 6 months must separate dose 3 and 4. For example, if a student got IPV dose 4 on September 1, 2009, and the dose was given when she was 2 years old, then this dose is not valid and needs to be repeated. Students in 7th grade and above do not need to adhere to the August 7, 2009 rule. The IVERS provides more detailed information about the IPV requirement. Also remember, you can look at the students in the IIS, and the vaccination forecast will show if they meet the IPV requirement. The forecast reflects the school requirements. MMR vaccine requirements have remained the same over the last few years. Here are some of the rules and exceptions for MMR. If a student got dose 1 before 12 months of age, this dose is not valid and must be repeated. The 4-day grace period can be applied if a student got dose 1 within 4 days of his or her first birthday. If the vaccine dose was given 5 days before the first birthday, then this dose is invalid and must be repeated. MMR and varicella vaccine, which are live vaccines, should be given on the same day. If they are not given on the same day, then they must be separated by 28 days. If they are separated by less than 28 days, the second vaccine given is not valid and should be repeated. Let's talk a bit more about the rule regarding live vaccines and the 4-day grace period. The 4-day grace period cannot be applied between doses of different live virus vaccines, but can be applied to doses of the same live virus vaccines. For example, a 4-day grace period can be applied between dose 1 of MMR and dose 2 of MMR. However, the 4-day grace period cannot be applied between a dose of MMR and a dose of MMRV vaccine. Next, let's talk about the varicella requirement. 2 doses of varicella or chickenpox vaccine are required for all students in kindergarten through 12th grade. Dose 1 of varicella vaccine must be given at a minimum of 1 year, and though 3 months is recommended between doses, if only 4 weeks separate dose 1 and 2, then dose 2 is valid and does not need to be repeated. The 4-day grace period rules that I spoke about for MMR also apply to varicella. There are other ways that students can meet the varicella requirement without getting 2 doses of vaccine. A provider can confirm that a student has a history of varicella disease by documenting it in the IIS, on the hard copy CIS, or with a letter. In addition, providers can enter positive blood titers showing immunity in the IIS as well. Parents can also request an exemption to the requirement. I'll talk a bit more about exemptions in a few minutes. So here's a snapshot of the hard copy CIS. This is the area that chickenpox disease or immunity by lab testing can be documented on the hard copy CIS. Healthcare providers can mark this box and sign here to verify that the student has had chickenpox disease. If confirming disease immunity with a titer, the healthcare provider completes this box and signs here. Schools are required to have a copy of the titer lab results on file with the CIS. Now let's talk about the validated CIS generated from the IIS. It shows if a child is complete or not complete for school or child care entry. The IIS assesses each child's immunization record by school requirements by grade and child care requirements by age. Here's a screenshot of the validated CIS. The certificate will display the status based upon the information in the IIS. It will either say pass, fail, or temporary. These terms indicate whether a child is complete or not complete with vaccine requirements for school or child care entry. The terms are defined as pass, a child has all of the required immunizations. Fail, a child has not completed all the required immunizations and is not in the process of completing the series. And temporary, which is what we also call conditional, is a child is in the process of completing a series of vaccination and is due for another dose in the next 30 days. If chickenpox disease is documented with the Add Chickenpox History button in the IIS, the word history will display here. If a varicella disease date is entered into the IIS contraindications, then that date will display here. If a positive titer with the date is entered into the IIS, then the word immune will display here. We have found a couple of issues with the IIS logic in determining if a child's CIS status is pass, fail, or temporary. One thing is that when a student is in conditional status or temporary, the CIS reports the student as a pass until the next dose in the series is due. If a child is in that DTAP family catch-up schedule, the CIS is inaccurately reporting a pass when the TDAP is still needed and the student is under 11 years of age. And titers that are entered without dates in the IIS are not showing up on the CIS. We are working to get these issues resolved as soon as possible. So please note that it is okay to handwrite notes on the CIS to change the status or add missing information. Next, I want to talk about exemptions. The exemption law passed in July 2011 requires a healthcare provider to discuss the benefits and risks of immunizations with parents requesting an exemption. A provider's signature on the exemption form is proof that the provider discussed an exemption request with the parent. There are 4 kinds of exemptions. 3 of them, personal, philosophical, religious, and medical contraindication, are documented on page 1 of the Certificate of Exemption form. And all of these require a healthcare provider's signature. Here you can see the place where the parent and the provider sign their declarations. Now let's take a closer look at the vaccine exemption box that the provider needs to fill out. There are 2 very separate sections of this table, separated by a bold line. The sections on the left are for personal, philosophical, and religious exemptions, which are parent-requested exemptions. When parents request exemptions, the provider should check the box for the individual vaccines the provider has counseled the parent about, or if appropriate, check the box for all. The section on the right is only for medical exemptions given to a student that has a medical contraindication to a vaccine. For example, a student who is immunocompromised and cannot receive live vaccines like MMR and varicella. Providers should put a P or a T in the appropriate box to indicate if a medical exemption is permanent or temporary. If it is temporary, put the expiration date in the next column. Remember, these columns should only be used if there is a medical contraindication to vaccine. If medical is noted on the same line as personal or religious, please confirm with the provider that the student has a medical contraindication to the vaccine. If it is a parent-requested exemption for personal or religious reasons, please do not record it as a medical exemption. Remember, these columns should only be used if there's a medical contraindication. The fourth kind of exemption is called a religious membership, and it is documented on page 2 of the COE. A parent may choose this option if they wish to name the religious organization of which they are a member that precludes healthcare practitioners from providing any medical treatment to their child. This exemption does not need a provider's signature. So now I'm going to turn it over to Jeff Zahir, who will walk you through how to complete the annual immunization report.
Good morning, and thank you for joining us this morning. Again, my name is Jeff Zahir. I'm the Assessment Coordinator for the Department of Health. That title won't mean much to most of you, but it's my responsibility to collect and summarize the data for annual reporting to CDC and on our website. Over the next 11 slides, I'm going to do two things. I'm going to walk you through the actual form itself, and I'm going to go through the process for reporting those forms. And after that, I'm going to turn it back over to Catherine for giving you more on the resources, and then to open with Trang and Catherine and I for questions. On this slide, you can see the form that we have. This is idealized from the IIS forms, and it breaks into 3 boxes. And just in brief summary, as an overview, you can see that the first box is that information about the school itself, giving the school name, the location, the person who completed the form. This is a portion of the form that every school needs to complete. The next part, that's called Part B, is for K through 12. Regardless of it includes all students in your school. And you need to count all of your students at your physical location who are in kindergarten through 12th grade. And then finally is Part C. And Part C is different. Part C is that group of, that subset from the Part B that are only in kindergarten or 6th grade. And we ask slightly different information from this part. And it will not be completed by all schools. If you don't have a K or you don't, or 6, you won't be reporting that. Now the key part here is in Part B, we'll go through the various cells that we've described here. Starting on the left-hand side, you can see that the first box is the total number of students enrolled. And that's the total number of the head count that you have on the date when you completed the report. In this case, for our example, we're counting 50 students in all grades. The next box in the Part B there is those numbers, the number of students that you have who are completely immunized as defined by Catherine earlier. And then in this case, we have the 35, which gives you about a 70% completion, which isn't ideal, but that's the number we're using for this example. The next part is the number of students that have an exemption on file at your school. And it doesn't matter if the student is exempt from one vaccine or for many vaccines, and it doesn't matter if the student has one type of exemption or all types of exemptions. You should count the total number of certificates of exemption you have. Count each student only once in this box, and in our example we have 8. The next box is count the type of exemption on the certificates of exemption that you have. In Washington, we allow the 4 types that Catherine described, the medical, the personal or philosophical, the religious, and then finally that religious membership, which was the one that didn't require a provider's signature. The medical exemption is reserved, and this is being emphasized here. It is being reserved to those few students who have true medical contraindications to the vaccine. The other 3 exemptions are about personal beliefs or non-medical reasons. And the number can be larger than the total number of students that have exemptions or certificates of exemption. For this example, 1 student has a medical exemption and 7 have personal and 3 have religious. And none have a religious membership exemption. Note that the boxes that are typed, I think you can see them here, the 1A through 1D adds up to 11, which is larger than the 8 students reported to have an exemption. In Washington, parents can pick and choose which exemptions they want for different vaccines. So a parent can declare a personal exemption to hepatitis B and a religious exemption to MMR, for example. This is allowed, and you may see these situations. So again, just count the number of students who claimed each type of exemption and enter the total boxes in 1A through 1D. The final one is the listing by vaccines. In the next section, it counts the total numbers who have exemptions by vaccine type. Parents indicate individual vaccines they want their child exempted from on the COE, on the Certificate of Exemption. So using the Certificate of Exemptions you have on file, count the total number of students who are exempted from each vaccine and enter these totals into the appropriate box on the report. Again, Washington law allows students to be exempted from any combination of vaccines, so the sum of the boxes in this section can be larger than the total number of Certificate of Exemption forms you have. Here, 6 students have exemptions to DT, 3 have exemptions to pertussis, 2 to polio, and 1 to MMR, and 1 to hepatitis B, and all 8 have exemptions to varicella. Here again, we want to emphasize that we have 2 different sections. One is for the K through 12, but we then also have this Part C, which only counts the kindergarten and the 6th grade, or both, kindergarten and 6th grade. It's only if you have kindergarten and or 6th grade that you continue to Part C. And then if you do, we reach the last portion. And again, the reason for this breakout is that we're asking for slightly different information in Part C. The first 3 boxes of Part C are the same as Part B, but are just for kindergartners. Record the total kindergarten enrollment and number of kindergartners who are complete, and the total number of certificates of exemption you have on file for kindergartners. For this example, we have 12 kindergartners in our school that have, of the total of 50 students that are in the school, 7 are complete and 3 have exemptions. The next 4 boxes are the same as Part B. Count the number for each type of exemption, medical, personal, religious, or religious membership, based on what you have on your Certificate of Exemptions. And again, in this example, 3 kindergartners have personal exemption and 1 has a religious exemption. The next 2 boxes are different than Part B. We don't collect the total number of students who are conditional or out of compliance in Part B. We only collect that part in Part C, in these next 2 boxes. Box 4 counts the total number of kindergartners that are in conditional status as previously defined. Remember, Part B doesn't include this category. For this example, 1 student has a conditional exemption. Count the students that are in conditional on the date that you completed the report. We're just doing a snapshot of your student's immunization status in time. So if a student completes their series and becomes complete after you report, don't send us a revised report. Just give us the report at the time that you complete it. Box 5 is the total number of kindergartners that you have that are out of compliance with immunization requirements. For this example, 1 student is out of compliance. Again, just count the students that are out of compliance on the date that you report. There's no need to submit a revised report if the student becomes complete later on. And in doing these, there's some possible points of confusion that often arise. So every student can have only one status: complete, exempt, conditional, or out of compliance. In Part C, we're counting all kindergartners and sixth graders and their immunization status. So in Part C, the sum of kindergartners who are complete, exempt, conditional, and out of compliance must equal your total kindergarten enrollment. In this example, 7 complete, 3 exempt, 1 conditional, and 1 out of compliance equals the 12 that are enrolled. In the next section, the last section here on section 3, counts kindergartners who are at risk for each of the diseases that are covered by the vaccine requirements. This section is different than Part B. We want the total counts of kindergartners who are missing one or more of the required vaccines for any reason. This includes kids who have an exemption, are in conditional status, and those who are out of compliance. We look at these grades because they mark a major milestone, entering the school system and entering adolescence. Again, the sum of each of these doesn't have to add up to the enrollment because the student could be exempt for multiple vaccines. So we're done with the kindergartners in Part C. What next? If you only have kindergarten, your report is ready to send to us. If you have 6th grade, then you have to complete the next row for your 6th graders. Follow the instructions we used for the kindergartners, and your report is done and ready to send to us. Once you've completed the report, it's important that we get the report by November 1st of each year, and that's kind of crucial for this. Again, as I said in the explanation of the filling out of the form, its purpose is just to get a slice-in-time view of the immunization status of your students. We need it by November 1st so that we can get the reports ready and summarized for reporting primarily to CDC, but also to you, and to post it on our website, which is a requirement of our contract with CDC. Besides being required by those conditions, it's important to know how many of our children are immunized or at risk for any preventable disease. At the state, we analyze the data, we publish it. Your school reports are one of our primary sources to assess immunization status of the children in Washington State. And again, we do report that to the CDC. And so that completes the summary of the form itself, and now we go on to how to actually report it. We'll start with how to report a public school if you're using one of the systems that the school information system called Skyward. As you can see, there are a number of resources available to you if you are a Skyward user. And in bringing that together, you are enabled to extract files, data files. These files come in the form of either flat files, CSV type files. A lot of you see those with Excel. But when you've extracted that data file, you send it then as an attachment to an email to oicpschools@doh.wa.gov. The second and the third bullets that you see there on in the resources are links for the instructions for how you actually complete those or develop those files. Send one file for your, in many cases, your district will actually compile the files for each school. So you need to be careful that you're not duplicating the reports. If your district is reporting for your school, let that report be the summary report for all of the schools. If not, then each individual school submits. If you have any difficulty in developing your Skyward reports, please follow up with your local ESD, and their contact information is shown here. Please do not email or mail the forms that were created in Skyward. A lot of times somebody will see that the form is filled out without actually generating the CSV or the electronic report, they'll take a screenshot of it and send us a picture or try to fax us something. We will send those back and ask you to generate the actual electronic data file and email it to us. The preferred method is actually, though, using the student information system, or the IIS. Do I have the IIS here? Oh, never mind. So those who are using a school information system that is not Skyward, and there are examples of that listed here. There's PowerSchool, Synergis, Aspen, eSchool. Many districts have the ability to create a data file to email to us from these. And you will have to check with your various providers to find out if that's possible. If you have more questions about that, however, you can feel free to send us an email at that email address that I shared with you earlier, oicpschools@doh.wa.gov. If you're a private school that uses a student information system, such as PowerSchool, you can work with your vendor there to generate data files. We know that they have that capability. And then your other option is to use the Immunization Information System, or IIS. When using the IIS, you log in under your reporting account. You'll see the list of the schools in your school district where you're located. Select your school and enter your annual report numbers. For private schools, we group all the schools, both public and private, under the public school district for that area for technical reasons. We have to be able to report how many children are immunized within a geographic region, and it's easiest to just use the school district as the geographic region. So if you're a private school, for example, Sunnyside Christian School, then your school is grouped under the Sunnyside School District. And when you go into the system, you'll see all the schools in the district. Just select your school and enter your numbers. The State Immunization Information System, or IIS, has an online reporting feature. You need to register with our system, but there's no paperwork necessary. Just send an email to WAIS-helpdesk@doh.wa.gov to request a new account. Reporting accounts are only for reporting. They're different than the accounts many school nurses use to see their patient records and to print the CIS. Your reporting account will have a different username than your account to look up student immunizations. You can report for any school in your district. So you only need one account, even if you report for more than one school in a district. If you report for multiple school districts, you need a separate account for each district. Please contact us if you report for schools in more than one district. That completes the review of what we have. Did I go backwards on that? I did.
So just jumping in, we've got several pages of some links with some great resources for you guys on these next several slides. So if you haven't already, I really encourage you to download the handout that is the PDF of these slides and has all that good information that you can refer to. In addition, in the handout section, you will find a certificate of attendance for this if you want to use that towards your continuing education file. So this resource slide has that school reporting webpage with a lot of great information, links, and how-tos about how to complete your report for schools. There's a separate page for preschool and childcare reporting, which also has awesome information on it. And as Jeff has mentioned twice, and I'm going to tell you here again, the go-to place for questions about reporting and requirements is that oicpschools@doh.wa.gov. That OICP is our section of the Department of Health that we work in. It's the Office of Immunization and Child Profile. So oicpschools@doh.wa.gov. We monitor that daily, and we will get back to you just as soon as we can. This next list of resources has our main school and child care webpage, which has all of the information about the requirements, the regulations, all of that good information, including the IVERS, is located on this webpage. It also, you'll see the vaccines required for school chart and the child care and preschool charts. There is the immunization webpage, which has got additional information, and the Immunization Action Coalition also has some very good resources that are out there as well. Here's a direct link to the IVERS, and there's some CDC links here for some job aids. If you have clinical questions about immunizations, then we do have a nurse's mailbox here. It's called immunenurses@doh.wa.gov. But for school requirement questions, again, use that oicpschools@doh.wa.gov. We get quite a few questions about the CIS, so here's some information about how to print it, some frequently asked questions, and places you can get the hard copy CIS and COE. And then if you have questions about the school module, there's a link there that you can see, and they also have a email address for school module questions. So after the webinar completes, we will have time for some questions, which is awesome. After we finish up, though, you will get an evaluation to pop up as you exit. So please, if you could, take just a few minutes to do that. The information you provide there really does help guide us in our future webinars and make sure we're meeting your needs for information and resources that are out there. So with that, I'll ask Trang if we have any questions.
Hi, this is Trang, and I'm one of the other nurses in the office, so I'm going to go ahead and ask questions. If you haven't already, please go ahead and start typing your question in, and then we'll ask Jeff and Catherine to answer your questions, and we have plenty of time. So go ahead and start typing in questions. I have one question in the question box. Are CIS forms from other states valid?
CIS forms from other states cannot be used in lieu of the Washington State CIS form. You need to have the information on the Washington State form, and it needs to be signed by the parent. That's our current law and rules around the form. Now, that said, you might be able to, with a parent, use some of the information on other CIS forms from other states, especially those that might be printed out of their student information system. Those would probably be very good and valid records, but that information does need to be transcribed onto the Washington State form.
Great, thank you. Okay, the next question. Do you have to have a medical professional submit the report, or can someone from office staff submit it? Do you want to take that, Jeff?
Yes. The office staff can submit the report, and it's encouraged to submit the report. The provider is required to do the signing for the area where Washington State requires it, but not to submit the report.
Great, thank you. Okay, can you explain conditional status, please?
Conditional status, and I'm just going to put a little plug in here for a resource that isn't on here, and I realize should be, but you can link it from that immunization page for the school and child care, and that's the immunization manual. So Appendix A of the immunization manual has FAQs about conditional status. It really goes into a lot of great detail that can help answer questions. But to go on an overview, conditional status is for a student that is in process of completing their immunizations. Conditional status is considered the first 30 days of attendance at school. So a child starting kindergarten is in conditional status for 30 days if they are not already complete in their immunizations. Student who remains at that same school the next year and starting first grade, if they were in conditional status at the end of kindergarten and now it's first grade, they do not get an additional 30 days at the beginning of first grade. They do, however, get that 30-day grace period when they either turn 11 and they are in 6th grade. So when that Tdap is a new requirement that they have to meet, they do have 30 days to get that immunization completed. During that time, they're in conditional status. Now, a student who is continuing to get immunizations in a series, so let's say the student has not had any MMR vaccine. So they enter school, they get their first dose of MMR, 20 days in, so they were in conditional status, and now they have to wait the 3 months to get their second MMR. They are in conditional status for that whole 3 months while they're waiting to get their MMR, their second dose, and they have a conditional period of 30 days following the date that they can get the dose to actually be able to get into the doctor and get the shot. When they go to 31 days past that date when that shot was due, they change from conditional status to an out-of-compliance status.
Great, thank you, Catherine. Okay, the next question is, we have families who are French and Canadian and just moved to the U.S. Is the French-Canadian immunization record valid?
Immunization records from out of country can be used as long as you can determine which immunizations were given. So yes, but they still have to meet our state requirements. So some countries, for instance, don't require 2 doses of varicella. We do, so they still have to meet our requirements to be in compliance with school attendance.
Okay. Do doctors get any training on completing the immunization waiver form?
That is a great question, because we certainly have seen some things with providers not always completing it correctly. And that's why I wanted to really emphasize to you that if you're seeing medical contraindications, and then there are also a personal or religious thing, then I'm thinking that there may be some error on the provider's part in understanding how to complete the form. The answer is yes. We are reaching out to providers. Matter of fact, we had a webinar just for them in June, kind of going over some of this very same information, and we're trying to look at other avenues to get that out there as well.
Okay. Quite a few parents have been told by their doctors they're up to date on their immunizations, but they actually require Tdap. Even when parents go back, the doctors say it's not needed. Had anyone else have this issue?
I can tell you, as a former school nurse, before I started working here at Department of Health, I know exactly what you're talking about and how frustrating that can be. And that is one of the reasons that I really do recommend, I found it very useful, that when sending a student to provider, especially in a catch-up schedule, copying that section and highlighting it of the IVERs, so along with that student's immunization record that that parent can take with them to the provider, really help to smooth the way for the providers giving the missing immunizations. These schedules are sometimes really complicated, and so I think anything you can do to provide documentation to help in that process seems to make it better.
Great, thanks. Okay, so is it the responsibility of the medical provider to document the COE or exemption status? And the question really is it the responsibility of the medical provider to document COE or exemption status on the CIS? But I think the question is the medical provider required to fill out the COE? If I got that question incorrect, please correct that, clarify the question in the question box, please.
So the COE, the part for the philosophical, personal, religious, and medical contraindications. Remember, that side has 2 sections. There's a section on the left that the parent completes, and the section is on the right that the provider completes. So yes, the provider does need to complete those. Now, if it's the religious membership one, that is only used for people whose religious beliefs do not allow them to see providers. Therefore, no provider signature is needed, but they do need to state the name of their religion on that form.
Great, thank you. There have been questions with the catch-up schedule and Tdap. Some clinics refuse to give another Tdap if they have been given one, but the student has only a total of 3 DTAP and Tdap. What is the best approach?
Again, in a situation that you just talked about, we wouldn't want to give them another Tdap. At that point, if they're needing more doses, then they would be needing to get a TD dose. And again, I'm going to point you back to the IVERS because it goes through that really clearly. A lot of it depends on the age, like was that first DTAP given before or after age 1, because that determines the number of total doses that are needed and when they need to be given.
Okay. The past CIS form that I received from my receptionist who got it from the parents. I'm not quite sure what the complete question is. So can you, whoever asked that question, can you please clarify that question, please? It's the question about the pass on the CIS form. And it looks like the parents gave it to the school receptionist.
With a pass on it?
Yeah.
Well, those CIS forms, a lot of providers are generating those too and giving them to parents when they're going in and getting their shots, and so when the kids are getting their shots. So you will see those coming, not just from schools, but parents might be bringing those in too.
Okay, great. What is the difference between out of compliance and unconditional?
Unconditional? We don't really have a status of unconditional. We either have conditional or out of compliance or complete, right? So a student, like I said before, a student that's in conditional status, when they fail to get their immunization within 30 days of the date it's due, they change from conditional to out of compliance. So that student then is not meeting the requirements.
Great, thank you. Regarding religious membership, I have received submissions under the name of religious organization that notes "my own," in quotes. How do you recommend we handle this?
So we have not directed schools to and school nurses to be the monitors of determining whether or not that religious institution is accurate, is a real institution, or is one that really does not allow medical treatment for their children. Yeah, that's a sketchy one, I have to admit, but we don't want to put you guys in the position of being the policeman for those religious membership exemptions. But one of the reasons we are tracking it on the immunization report is we want to know how many people are claiming those religious memberships to see if we see a jump over time. So far, we really haven't. Those religious memberships are a very, very small portion of the exemptions that are currently in our state.
Great. Are there promotional materials available for MyIR?
There are some on the MyIR website. There's some information there too. There is like a half-sheet flyer that we have staff that can get you that you can print and give out to parents so that they can get signed up to MyIR. Yeah, we'd love that.
Great, thanks. Is there a good program for private schools to use in order to track all of this info?
Yeah, private schools, it's kind of tough, I know. I'll put a little plug in for our school module that we are in the process of rolling out to schools across the state. The school module is actually a part of the IIS, a special program within it that allows schools to create a roster of their own students out of patients that are in the IIS and to do the compliance work of tracking who's in compliance and who's conditional and who's out of compliance and what immunizations they need. It also has letters to send home to parents and providers and different reports available. So it's a great tool. If you're interested in more information about the school module, there's a link on the slide, and there's some really great information on the website there.
Great. So this is a clarification of the question. When the parent gives us a form without a signature, is it important to follow up with a signature?
Yes, it is currently required for parents to sign the CIS. So yes, you should follow up with the signature.
Great, thank you. This is a Skyward question. How do you document varicella exemption on Skyward?
You know, I am not a Skyward expert, I must say, so I would refer you back to that ESD list that shows your Skyward resources, because that is a separate system from our system here at the IIS.
Great, thank you. So I have 3 religious membership waivers from a parent with 3 almost fully vaccinated children. They list the church as GFY, which we won't explain what that means. But what should the school do? The superintendent is new and is at a loss as to how to respond. What is your direction on this?
My direction is, if you've got a religious membership exemption and students are almost fully immunized, I would apply the religious membership exemption only to those vaccine series that are not complete yet. So if that student has completed their MMR series or their varicella, but maybe they haven't gotten their Tdap, so you might apply that exemption to the Tdap. But if they've completed MMR and that series or other series, then don't add that exemption to them in that category. That's how I would handle that.
Okay, thank you. Okay, do we report for infants in the pre-kindergarten or preschool?
We do have reports for preschool, but that is a separate issue from what we've been covering today. There are additional resources that are available. If you write me at that email address, I'm happy to send you that information. And we may have a follow-up webinar or some other materials made available to those schools that have preschool.
And then there's also great information on the website.
On the website,
right, for that. And there's a link in the slides.
Great. I think that is all the questions.
Well, thank you guys so much for attending and listening, paying attention, asking great questions. Again, we are here to help with this process, so feel free to email us at that. You should have it memorized by now, oicpschools@voh.wa.gov, and we will get back to you. So thanks, and hope you have a really great rest of your day. Bye.